You've seen the ads, miracle facelifts, next-gen lipo, fillers that replace surgery. Here's the truth, most of it is just marketing. Today, I'm gonna walk you through the trends in plastic surgery that don't live up to the hype, and why you should think twice before spending any of your money on them. Hi everyone, I'm Dr. Shim Ching, board-certified plastic surgeon here in Hawaii. I've been practicing for 20 years. I've seen dozens of trends just come and go. Some sound revolutionary when they're first marketed, but once the excitement dies down, we're left with the reality. The results just don't match the promises. What I want to do today for you is to break down some of the most popular, in my opinion, problematic trends in cosmetic surgery right now. Along the way, I'll share some stories, some examples, some insights from conversations with my colleagues that I think will help you make more informed decisions. So let's start with one of the most confusing things I see online: facelifts with fancy brand names. You probably heard of terms like ponytail lift, maid lift, vertical restore, or other catchy names that make it sound like only one surgeon in the entire world has that secret recipe. Well, here's the truth. Nobody owns the facelift. These are marketing terms. They might sound exclusive, but when you look under the hood, these branded facelifts are just usually variations of well-established facelift techniques. Deep plane, smash, short scar approaches that many qualified surgeons can perform every single day. So I had a patient once come in who recently told me, I was told this one special lift is the only one that would work for me. She was about to travel all the way across country to get it done. When I showed her that the approach was really just a variation of techniques that I already offer, and explained to her why I'd recommend one over another in her specific case, you could see the relief on her face. She actually realized that she didn't need a trademark name. She really needed a skilled, experienced surgeon that she can trust. So don't pay for a label, pay for expertise. Next, let's talk about energy devices. Every year, it feels like there's a new one. EMFACE, Sofwave, Skin Tight, the list goes on. And the claim is always the same. This can lift your face without surgery. Now, do these devices actually do something? Sure, they do. We offer some of them here in our med spa. They can heat tissue, cause some contraction, and in some cases you'll see a mild tightening effect. But let me be very clear, these are not facelifts. I've had some patients come in after spending thousands, sometimes tens of thousands, over several years on these treatments. They hoped to avoid surgery, but when they looked in the mirror, nothing really changed. Their jawline was still soft, their neck was still loose, face was still sagging. And sometimes these devices can actually make things worse. I've seen patients who lost fat in the areas they didn't want to, especially in the face. That loss of volume can actually make you look older, not younger. Here's the behind the scenes reality. As surgeons, we talk to each other about these devices, and almost every colleague I've spoken with says the same thing. The results are underwhelming. Yet the devices keep getting rebranded, remarketed, because the demand is there for something non-surgical that will lift the face. If your face is sagging, if your jowls are heavy, if your neck is loose, no energy device is going to fix that. But a properly performed facelift will. They can smooth wrinkles. They can restore volume, they can enhance features, but they are not a substitute for lifting sagging tissue. Here's what happens. A patient noticed their jawline is softer or their cheeks are drooping, and instead of being referred for a surgical consultation, they're told, we can fix this with filler. So more and more filler gets added into the face to try to camouflage the sagging. At first, it seems to help, but over time, the face starts to look wider, heavier, and unnatural. This is the pillow face look that we've all seen online and social media. I had one patient who'd been doing filler for almost 10 years. She came in unhappy, saying she didn't recognize herself anymore. When we dissolved all the filler, showed her photos from her 30s, she was shocked. She realized the fillers hadn't made her look younger, they actually made her look different. Fillers cannot lift. They are not designed to. And unfortunately, some injectors will keep adding filler because they don't want to lose a patient to a surgeon. But the truth is, once sagging sets in, fillers can't solve it. A facelift is the correct tool. Finally, let's talk about liposuction, specifically the constant stream of new and improved devices. Water jet lipo, tickle lipo, VASER, Renuvion, J-plasma, BodyTite. Every few years, there's a new device being marketed as the next generation, the next best of liposuction. Here's reality. These are just tools. A device can't make anyone a better surgeon. The quality of your liposuction result depends on the surgeon's eye, their judgment about how much fat to remove, where to contour, and how to shape the body. I've seen patients who are sold on one of these miracle machines. They came in expecting a sculpted body because of the technology. But the truth is, their result looked no different than traditional liposuction because the technique wasn't there. Now, that doesn't mean these devices are worthless. Some can be helpful in specific cases, but the marketing often oversells them. And patients are left thinking the device itself is what creates the magic. It really doesn't. The surgeon does. If you want a great result, don't chase the latest gadget. Choose a surgeon with skill, experience, and artistry. At the end of the day, trends will come and go. Fancy names, new devices, flashy campaigns, they'll always be around. But the fundamentals of good surgery don't change. It's about safety. It's about realistic expectations. It's about choosing the right procedure for the right patient. So when you're considering a procedure, don't get distracted by the hype. Ask questions. Look at real results. And focus on the surgeon and the plan, not the trend. Because what lasts is not the marketing. What lasts is a beautiful result that you're going to get.